About 80% of men and women have some sort of chest symptom, but that may not be pain. It may be pressure or burning or squeezing. It may radiate to the shoulders, to the neck, to the jaw, between the shoulder blades. Sometimes there'll be shortness of breath or nausea and vomiting or a clammy feeling.
Warm Dr. Man. Dr. Sharon Hayes, a cardiologist and founder of the Mayo Clinic Women's Heart Clinic, once said, "Heart disease doesn't scream in women, it whispers." Many women over 50 experience a strange, fluttering heartbeat during menopause. Most brush it off as anxiety or hormonal chaos. But what if that tiny flutter is your heart waving a red flag? Studies reveal that one overlooked menopause symptom may actually be an early sign of cardiovascular disease, the #1 killer of women post-menopause. So why do so few doctors talk about it? Let's uncover what your body might be trying to tell you before it's too late. For millions of women entering menopause, heart palpitations, that sudden feeling of your heart skipping, fluttering, or pounding, are dismissed as nothing more than hormonal mood swings or hot flashes in disguise. It's a common assumption. It's just stress, or it's probably the caffeine. But here's the dangerous truth. This symptom may not be as harmless as it seems. Research shows that after menopause, women's risk of heart disease skyrockets, in part due to the drop in estrogen, which normally helps keep blood vessels flexible and responsive. Ignoring these subtle signals can delay early diagnosis and life-saving interventions. In fact, many women don't realize they have heart disease until they experience a heart attack, and by then, the damage is done. Could your body already be whispering a warning?
Estrogen isn't just a reproductive hormone. It plays a vital role in protecting the heart. Before menopause, estrogen helps maintain the flexibility of blood vessels, supports healthy cholesterol levels, and reduces inflammation in artery walls. But when estrogen levels decline during menopause, this protective shield weakens. The result? Blood vessels become stiffer, more prone to plaque buildup, and less able to dilate properly, setting the stage for high blood pressure, arrhythmias, and even heart attacks. This is why heart palpitations, a seemingly minor symptom, deserve more attention. They can be the first sign that your cardiovascular system is under stress. Dr. Nika Goldberg, a renowned cardiologist, warns that women often experience different and more subtle signs of heart trouble than men. While men may feel chest pain, women might just notice fatigue, anxiety, or that fluttering heart sensation we often dismiss. By the time a woman is officially diagnosed with heart disease, the condition may already be advanced, simply because no one connected the dots earlier. Understanding how hormones influence your heart is not just knowledge, it could be the key to preventing tragedy. Mistake number 1. Dismissing heart palpitations as just stress. It's easy to explain away that fluttering feeling as a result of caffeine, anxiety, or fatigue. But repeated episodes, especially during menopause, should raise concern. Stress may be a trigger, but it's not always the root cause. Mistake number 2. Assuming menopause symptoms are unrelated to heart health. Many women separate menopause and heart disease in their minds, but the drop in estrogen affects the entire vascular system, not just reproductive health. When palpitations or shortness of breath arise, they're often early cardiac warnings. Mistake number 3. Relying solely on basic checkups. Standard checkups may include blood pressure and cholesterol, but they rarely look at hormonal shifts or subtle cardiovascular changes unique to postmenopausal women. Without deeper screening, critical signs are missed. Mistake number 4. Not speaking up. Too often, women don't report these symptoms, thinking they'll pass. Or worse, they're told it's all in their head. This delay in communication can cost valuable time for early intervention. Recognizing these mistakes is the first step towards reclaiming control of your heart health during and after menopause.
Talk to your doctor and be specific. If you're experiencing palpitations, don't just say, "I feel off." Describe exactly what you feel, when it happens, and how long it lasts. Insist on a full cardiovascular evaluation, especially if you're postmenopausal. Request tests like an EKG, stress test, or echocardiogram to rule out early heart issues. Track your symptoms in a journal. Write down when the palpitations happen, morning, after meals, during stress, etc. Patterns can reveal hormone-related triggers and help your healthcare provider connect the dots between symptoms and underlying issues. Focus on heart-supportive nutrition. Add foods rich in magnesium, potassium, and omega-3s like leafy greens, avocados, flax seeds, and salmon. These nutrients help regulate heartbeat, reduce inflammation, and support blood vessel health. Avoid excessive caffeine, alcohol, and processed sugar. Consider hormone evaluation, but carefully. Hormone replacement therapy, HRT, may help some women, but it's not for everyone. Work with a doctor experienced in menopause care to weigh risks and benefits. Even without HRT, natural methods like phytoestrogens found in flax and soy may offer mild support. Move daily but gently but consistently. Light cardio, yoga, or walking 30 minutes a day improves circulation, reduces stress, and stabilizes heart rhythm. Don't wait until symptoms worsen. Prevention starts with action. Empower yourself with information, speak up, and treat your heart as a priority. Menopause is a transition, not a reason to ignore your body's signals.
What seems like a small, harmless flutter could be your body's early warning, a gentle knock before the storm. Menopause doesn't just change your hormones, it shifts your entire cardiovascular landscape. But knowledge is power, and timely action can mean the difference between prevention and regret. So if your heart has been speaking, even in whispers, listen. Share this video with a friend, a sister, or a mother. You might save a life. And don't forget to subscribe for more doctor-backed tips on senior health, hormone balance, and longevity. Your future self will thank you.